Professor Constantinos Pattichis will make a small introduction to our webinar today about the synergy between the European International Patient Summaries in the context of global healthcare, and I will take, after the introduction, the rest of the webinar.
Yeah, good evening, everybody. First of all, I would like to express our sincere thanks to Nimat and Theodoros for inviting us to give this lecture. Actually, I'm coming from the university from an IEEE students branch event to promote IEEE. I remember 40 years ago, I was an IEEE student member, and now actually I got the letter today that I am an IEEE life member. After 65, you are a life member. You are not anymore. Thanks to everybody. I will give. I am also a member of the IEEE Engineering in Medicine Biology Society, a technical committee, and the work carried out by our group at the Biomedical Engineering Research Center is focused on eHealth. And we are going to present to you today with Maria and Panayiotis the main activities of our lab. Our lab is focusing on applications both for the primary use of health data as well as for the secondary use of health data. And in 5 years ago, in 2019, Professor Schizas, a colleague also of IEEE and former member of the IEEE of the Department of Computer Science of the University of Cyprus, played a catalytic role in establishing the eHealth law in Cyprus. And the concept of the eHealth law in Cyprus is that a single eHealth record data bank is needed to connect all the digital health services, incorporating emergency services and all the healthcare professionals. And as Cyprus, given that we are a member of the European of EU, European Union, we work towards cross-border services. That's why you can see that we are trying to connect Cyprus with the rest of the member states. This is under the My Health at EU program that is established in EU for connecting the different member states together so that a patient summary, for example, Maria will expand on this later on, can be shared if a Cypriot citizen is in Athens, for example, his or her patient summary could be shared in another member state, or EU citizens can share their patient summary or a prescription in Cyprus. And at present, we envision that by the end of the year, Cyprus will also be connected under this project, and you will hear more later on. Moreover, we have been funded under the National Research Promotion Foundation with an €1 million grant to develop a prototype eHealth record. The title is eHealth for You, that is going to be presented in the context of these two presentations. In addition to the eHealth record presentations to be presented, we have also recently managed to secure funding for the secondary use of health data aligned with the new EU European Health Data Space regulation. So as you will see later on, the solutions that we propose are aligned both with MyHealth.eu, that is the EU cross-border service, as well as with the international patient summary requirements and protocols. And you will hear more about these two projects by Maria today and Panayiotis on Friday. I have mentioned this as an introduction, just to say again that eHealth for You was an integrated national eHealth ecosystem funded by the Research Promotion Foundation of Cyprus, and we followed strict adherence to well-known interoperability standards that, like the HL7 FHIR. And I'm not going to say more. You are going to hear more by Maria and Panayiotis, and you are more welcome later on also to ask any questions regarding the presentations. So I will pass the floor to Maria for her presentation. Thanks a lot from my side.
Thank you, Professor Pattichis, for the introduction. So moving to the rest of the webinar today, I'm presenting you here the parts of this lecture. So we have three main parts. The first one is about the patient summary evolution at the European and international level. The second part is a comparison that was made between the European patient summary and the international patient summary, and these two parts will be presented today by me. While the third part is about international and national implementations and with a focus on the eHealth for You project, and will be presented by Panayiotis Savva next Friday. So let's move on to the first point of today's lecture, which is the patient summary evolution at the European and international level. Moving to the first step of this evolution story, the patient summary first appeared in 2008 as one of the two European cross-border services, along with the e-prescription service. These services, the two services, were launched by a pilot project called European Patient Smart Open Services, with the acronym EPSOS, which later, between the years 2014 and 2020, evolved into the eHealth Digital Service Infrastructure, or as it's called, EHDSI, supported by the Connecting Europe facility. In the meantime, in 2011, the eHealth network emerged as a collaborative initiative established by the European Union. The main focus of the eHealth network was to create a framework for the European cross-border health data exchange, including, of course, the European patient summary. Since 2013, the eHealth network has been publishing guidelines for the European patient summary and, of course, for the e-prescription and some other key guidelines. In 2019, the technical committee 251 of the European Committee of Standardization took the initiative to develop the famous International Patient Summary Standard, building on the European guidelines that we mentioned before for the cross-border exchange of patient summary data, but now at global scale. A year later, more specifically in 2020, the cross-border services provided through EHDSI are referred as MyHealth at the EU, that Professor Pattichis also mentioned earlier, under the EU for Health program. And MyHealth at the EU will run until 2027, implementing the eHealth network guidelines that we also referred earlier. In the same year, the technical specification 17288 was published, and this specification offered the implementation guidance for using the International Patient Summary dataset within a European context. In the subsequent year, ISO 27269 replaced the earlier technical specification, and ISO 27269 defines the core dataset for the patient summary documents, ensuring the continuity of care and international healthcare coordination. This standard was implemented and has been implemented and published since then as HL7 FIRE and HL7 CTA implementation guides. Now, fast forward to 2021, the Integrating the Healthcare Enterprise, also known as IAG, stepped up and they introduced the IAG IPS profile, aiming to standardize clinical data and messaging worldwide. In this direction, IAG provided the IAG sharing of IPS with the acronym SIPS profile, which binds essentially the IPS content as in the ISO standard that we saw earlier with the IAG document sharing infrastructure using the HL7 FIRE standard for now. So that was a brief evolution of the patient summary through the last years. And so let's now arrive at the present, about the current state of the two summaries, the European and the international summary. And that's, let's see that as a snapshot of these two initiatives today. So currently, the European patient summary is implemented based on the eHealth network guidelines, and more specifically the release 3.3, published in June 2023. And as we said, it is an integral part of MyHealth at the EU initiative. In parallel, the International Patient Summary is implemented based on the ISO 27269 that we also saw when we presented the evolution of the patient summaries. And as we also said, one can use either the HL7 FIRE implementation guide, version 1.1.0, or the HL7 CTA R2 release 1 to implement it. As we said, there is also the IAG IPS profile that can be used and can be combined with the SIPS profile to exploit the IAG sharing infrastructure as well. By January of 2024, 10 European member states were able to exchange European patient summary data either as country A or country B or both. And you can see the exact countries that managed to accomplish that. And of course, we as Cypriots, we are very excited that Cyprus, along with some other member states, will be also joining the European Cross-Border Patient Summary Exchange service very soon, expected to be done by the end of this year. Now, about the international patient summary, 7 countries are currently involved in different developments around the international patient summary, including Cyprus, with the implementation that was mentioned earlier again by Professor Pattichis, eHealth for You, and which actually was the reason why we were involved in this to our effort to analyze the European and international patient summary and proceed to the comparison that I will present later. So, and this is only the beginning, as several other initiatives around the globe are promoting and proposing IPS to be engaged by nations for cross-border healthcare delivery globally, such as the G7 countries, publishing a specific IPS roadmap for the nations, the Global Digital Health Partnership, and the Community of Interoperability Labs in Asia, selecting the IPS as the Asia eHealth Information Network core. Now, as I said earlier, we exploited both the European patient summary and the international patient summary to implement the prototype, a prototype of the national EHR system of Cyprus that could optimize and exploit all the interoperability capabilities that come along with the implementation of these 2 patient summaries. So with all these dynamics at play, both the European patient summary and the international patient summary, they became inevitable for us to develop them as part of this prototype. So we needed to be aligned with both of them. And our goal was to actively participate at the end in the European cross-border healthcare services and expanding our global cross-border interoperability capabilities in terms of the patient summary. To achieve that, we understood that we needed an interoperability framework that could meet the requirements for both standards. So we proceeded to this comparison between the 2 patient summaries, trying to spot differences and identifying potential areas that needed resolution. So our ultimate aim was to ensure that we could achieve, based on the implementation of our prototype for the national EHR system of Cyprus, to be able to effectively serve the requirements of both patient summaries. Our comparison was focused on the structure of the 2 patient summaries and their semantics. The structural comparison was further analyzed in terms of document structure and included data elements considering their cardinality or any other constraints. The semantic comparison involved assessing the binding strengths, the required value sets, and the mapping consideration for both summaries. As stated before, the comparison was made with the ISO 27269 published in 2021 and the eHealth Network Patient Summary Guidelines release 3.3. So let's begin the structural comparison with the document structure of the 2 summaries. We initially attempted to document the requirement descriptors for both summaries, which are used to describe the document itself, the document's section types, and their associated data/elements. Essentially, we map the requirement descriptors based on their actual meaning and the actual constraints they put on the document section types and data. So during this process, we observed that both the international patient summary and the European patient summary use similar language for their descriptors. However, there is one key difference, as you can also see in this presentation. The international patient summary includes the descriptor required if known, which is not present in the European patient summary. So a required if known element or section is one that should be provided if there is information available. The element or the section shall be present where it is applicable, let's say. And if in the case that there is no information available, the element can be omitted or can be left empty with some exceptional or null values depending on the implementation of the patient summary. As a second step, we analyzed what we call here the data blocks, or we can also call them the sections of these documents, the patient summaries, and their corresponding conformance degrees. Our initial task was to understand which sections were essential for inclusion in the Cypriot patient summary to meet the requirements for both European and international patient summary, and with a special focus for the sections and elements falling under the mandatory sections category, as well as the required sections. Next, we aim to integrate all the additional sections from other conformance degrees that we will see in the next slides to enhance the patient summary as an outcome of our national EHR system. So this approach allowed us to prioritize our work effectively. So when examining the mandatory data blocks, as you can see in the first row of this table, we notice some differences. The European patient summary includes, for example, medical devices as a mandatory section, along with the significant procedures. And however, these two elements are not in the mandatory sections of the IPS, but appear in the required sections of the IPNs, along with some other sections. So, since our goal was to establish also global interoperability and European interoperability for the patient summary, we integrated these sections into the Cypriot patient summary as part of the national EHR. Here, as I said earlier, you can see the optional data blocks, or how we call them the sections, and it's evident that the European patient summary seems to include more optional sections than the international patient summary. However, as you can see, many of these European patient summary optional data blocks fall into the required if known category that we previously presented in the previous slides for the IPS. So most of them are actually included also in the IPS and have high priority to be implemented for the Cyprus patient summary. Notably, the European patient summary section on medical alerts is absent. There is no corresponding section for the medical alerts in the international patient summary. But as we know, it is very likely that this will be added in the upcoming version of the international patient summary, and we will also talk about that later in this presentation. Lastly, for the patient summaries, there is this provision for no patient summary data separately from the rest sections of the patient summaries. So the European patient summary restricts this provision to PDF files. They are not part of the structured document, whereas the international patient summary allows their exchange as part of the document, but it does not make any conformance test for them in terms of the IPS document. So it is worth noting here that the international patient summary has this element called content status for the mandatory sections. And this element indicates the absence of a missing data of the related section. And so if this element, the content status element, if this is true, then the related section is allowed not to include any data. But if there are available data, of course, the content status element can be omitted. It shall not be used. Now, when considering the document structure hierarchy, we have the European Patient Summary that requires implementation using the H7 CTA format, Clinical Document Architecture format. So this operates with 4 levels of hierarchy. The first level, level 0, indicates the title of the included sections. For instance, in our example given here, to understand the hierarchy of these levels, the patient clinical data, for example, could be is a title used in the European Patient Summary. The next level, level 1, represents the conceptual grouping of these sections. And for our example, we have the medical problems. So level 0 is the patient clinical data, the title, and then we have the grouping of these concepts that will fall under this title, and this is the medical problems, for example. The third level, level 2, corresponds to the name of each individual section that belongs to this conceptual grouping. And for our example, you can see here that we have the list of current problems or diagnoses, the list of medical devices, procedures, and the functional status. So the last level, level 3, includes the actual data elements that comprise this each section. And for our example, this could be for the procedure code under the procedures of code, the section of procedures. On the other hand, the International Patient Summary does not prescribe any specific implementation technology. Currently, it is available in both HL7 FHIR and CTA implementation guides. Hierarchically, the International Patient Summary differs from the European Patient Summary. So the International Patient Summary document is constructed using various data blocks or sections. I give here the example of medication summary as a section, individual section comprising the total document. And then each section, in turn, comprises elements. For example, here under the medication summary, we have the reason for the medication record, for example. But also, it can also comprise label concepts, which are also called containers, which further house elements or other sub-containers. So, for example, the medication summary that we said earlier can have as a container the medicinal product that is comprised by other set of elements, and so on. So, as we mentioned in the slides earlier, the alerts section is part of the European Patient Summary. And this section covers both the allergies and intolerances, which are considered mandatory data blocks, mandatory sections in the context of the European Patient Summary. And additionally, it includes medical information related to anything other than the allergies and intolerances. And this second part of the alerts falls under the optional category of sections. Now, as we said, the International Patient Summary does not currently include this kind of specific data devoted to the alert section, at least not in the 2021 version. However, as we said, it is expected to be included in the next version of the ISO 27269 standards. And with that, we get to the next point of our comparison. It's the structural comparison between the European patient summary and the international patient summary, which is the included data or data elements included in the summaries. So in this context of the structural comparison, we conducted an analysis of the structural conformance. Is there any question? Because I cannot see. Okay. So I continue with my presentation. So we conducted this analysis in terms of structural conformance between the data elements in both summaries. And you can see here the table with the resulting statistics. We categorized the patient summary data into three main groups. We have the non-clinical administrative data, the clinical data as a second category, and the metadata provenance data as a third category. And so we tried to analyze element by element each data that is included in these categories between the European patient summary and the international patient summary, and try to understand the differences in the conformance descriptors that they have for each data point. So we have two main categories of results: the major conformance issues, which this occur when an element in the European patient summary has a required or mandatory conformance degree, while the corresponding data element in the international patient summary is optional or even absent, and of course vice versa. And the minor conformance issues arise when an element in the European patient summary has an optional conformance degree and is missing, is absent in the international patient summary, or again, vice versa. So notably, there is a significant number of major conformance issues for the clinical data category particularly. And given that the clinical data, of course, constitute the bulk of information included in the patient summary, we needed to address these differences in our implementation for the Cyprus patient summary, so we can be aligned with both patient summaries at the same time. So here you can see some examples of these major conformance issues. We have 4 cases. The first case, I give 4 cases and some examples per each case, so you can understand what we mean with the major conformance issues. So the first case is when an element in the European patient summary has an optional conformance degree, while in the international patient summary is required. So we have here 2 examples. The pregnancy date of observation is a data element that is optional in the European patient summary and required in the international patient summary. And the vaccine for type of disease, again, is optional for the European patient summary and required in the international patient summary. So the second example of major issues that we found in the conformance between the 2 summaries is when an element is required for the European patient summary and optional for the international patient summary. We have here again 2 examples, being the vaccine medicinal product for the first example, and the second is the social history observation code. The third category is, the third example is when an element is absent in the European patient summary, but required in the international patient summary. And an example for this is the element problem type, which is included as required in the international patient summary. And finally, the fourth example is when an element is required in the European patient summary, but absent in the international patient summary. And an example for this is the vaccine prophylaxis description. So the last dimension of this comparison involves the semantics with emphasis on the terminology that both summaries utilize for their needs. The semantic comparison between the European patient summary and the international patient summary involves several facets. So the first one is the semantic strategy. For the semantic strategy, the European Union has a common semantic strategy for health, published by the eHealth network in 2019. And so the European patient summary adheres to this common semantic strategy. Whereas for the international patient summary, unlike the European patient summary, lacks this rigid semantic strategy. However, there is in the community a strong encouragement for the adoption of international standards, and where applicable, the International Patient Summary recommends using the SNOMED CT International Patient Summary free set. Now, the second facet of this comparison, the semantic comparison, involves the terminology services. The European Patient Summary is supported by the European Central Terminology Services, and these services periodically update and publish what we call the Master Value Catalog. We have a dedicated slide later on for this. But briefly, let's say that it is a resource that is provided by this and supported by the European Central Terminology Services, which includes precisely defined value sets for the concepts included in the European Patient Summary. So any user that exchanges the European Patient Summary must be semantically conformant with the Master Value Catalog. And so they should be define their value sets using the Master Value Catalog for their patient summary. In contrast, the International Patient Summary does not have this centralized terminology service, but they provide, as we said, the SNOMED CT International Patient Summary free set, which can be used to define value sets for several IPS International Patient Summary concepts. Notably, as following the concept of these terminology services, the binding strength of the European Patient Summary to the Master Value Catalog value sets is mandatory. So we must use, if we want to be aligned with the European Patient Summary, we must use the included value sets in the Master Value Catalog. So remember that exchange the European Patient Summary uses the same value set and the same value codes for the European Patient Summary elements. On the other hand, since the International Patient Summary does not have any central terminology services, it's more flexible and allows the adoption of different value sets for the same data elements included in the patient summary. And where applicable, they recommend, as we said, the SNOMED IPS free set of value sets. Now, in the cases that there is a need for semantic transformation, the European Patient Summary imposes this condition that both the transformed data values and the original health data values must be accessible when a patient summary is exchanged. either to the patient or with a healthcare professional. In contrast, the International Patient Summary does not have such a strict requirements, and it depends on the implementation, how they will manage that case. Lastly, within the context of the European Patient Summary, free text is not permitted for structured elements. In the case of the International Patient Summary, free text is allowed if the binding strength is more flexible, but there is always the recommendation to utilize, of course, structured values, codes for the definition of the values for the elements. Now, since we referred earlier to the master value catalog, I thought it was important to shed some more light on it. As we said, this is a collection of value sets comprising what we call a common vocabulary to describe this data. It is the outcome of an agreed selection of sets of concepts that comprise the patient summary in the European context. And of course, it also includes their designations from the selected code systems. The selection of the code system is based on mainly on international code system, whenever possible, and it is made in a way to facilitate the understanding of the health data exchange. The master value catalog is developed and managed by the HDSI that we mentioned when we talked about the evolution of the patient summary. And it helps so that the European member states can achieve the adoption of what we say a single clinical terminology. To be able to do that, every member state makes, if necessary, any transcodings, transformation of their national code systems and value sets to ensure the correct exchange of patient data with other member states. And that's why we earlier referred to this constraint that the European Patient Summary has, that both the transformed value and the original value must be sent whenever a patient summary is exchanged. So to be able to support that, the master value catalog also includes the designation in multiple languages. The International Patient Summary provides a set of value sets. Maybe they're not bounded with a required performance degree, but they are provided in a structured form in the International Patient Summary File Implementation Guide. In spring of 2022, we proceeded to a comparison of these value sets found in the File Implementation Guide of the International Patient Summary, and they might not even be created as part of the International Patient Summary File Implementation Guide, but they might even be available in file format by the File Core Implementation Guide, but still they are available in file format to be used. And so we spotted these file value sets, and we proceeded to a comparison with the value sets that are included in the master value catalog. So each value set was compared value by value, looking for the same code system and the same code per each entry. So here you can see on your right in the chart, you can see the outcome of this comparison. And as you can see, almost 50% of these value sets, of the master value catalog value sets, were given in FHIR totally with the same values. They were equal. Or, if not equal, the FHIR value set was a superset to the master value corresponding value set. So it included all the values of the master value catalog value set and some more. So we did that because we wanted to identify what was already available in FHIR, because eHealth for You was implemented, as we said earlier, using FHIR, so not as to decrease the amount of effort needed to be done creating new value sets to address the requirements of the master value catalog. So 50%, almost 50% were equal, or at least the requirements were satisfied with within the FHIR value sets. Then almost 40% had different values. So the FHIR value sets could not meet the needs and the requirements set by the master value catalog corresponding value set, and could not be used to be semantically conformant with the master value catalog for the European patient summary. And then almost 10%, something more than 10%, needs further investigation, because we have different versions of code systems, and we need to see if they are aligned, or if they indeed can be considered equal or not. So more investigation is needed for this category. You can see the actual numbers of the value sets that fall under this category. So we have in total 11 master value catalog value sets that can be found in FHIR format, the same, totally the same. All the values are equal. Then you can see that we have 10 FHIR values, 10 master value catalog value sets that we found they are supersets in FHIR value sets. We have equal or superset master value catalog, but they are not used by the IPS, so they are available in FHIR format, but not used by the International Patient Summary Implementation Guide. They are not recommended for use in the IPS Implementation Guide in FHIR. We have 4 of them. Then we have 17 different value sets between the master value catalog and the FHIR given value sets. And then we have finally 6 value sets that needs further investigation. Now, to the last point of comparison here, we have this document testing for the patient summary. So for the testing, there is a specific set of steps that needs to be followed during organized projectathons for the European patient summary, where a member state can test whether it is capable of exchanging, receiving, or sending a patient summary with other member states within the European Union. So by the implementation of all these steps that you can see here, and it takes weeks to accomplish the whole projectathon, the member state that achieves to successfully complete all the steps receives the validation report and the OSR that allows them to proceed to the next wave of the patient summary, or if they get to that point, go live and be actively participating to the MyHealth@EU initiative with the cross-border services in terms of patient summary. So you can see here that the first week involves the registration. The second week is about testing the connectivity through Telnet with each participating country. The third week is the pre-projectathon phase, where the member states can check the ability to send and receive data for the patient summary. And then the fourth week is the actual projectathon, where the member states exchange the patient summary with a participating country. So we have pairs of countries trying to exchange the patient summary documents and understand the patient summary that the other country, the other member state sends and they receive. So they have to run different scenarios of these exchanges, and everything is logged in the Gazelle platform that is used for the projectathon. And there is a validator from the European solution provider that checks whether there is a successful exchange of this data and validates technically the service. The fifth week, we have the functional end-to-end testing, where the European Union gives a questionnaire for the tested services. So, for example, a patient summary to a doctor, and the patient summaries is sent as to be defined by the corresponding member state, and the doctor needs to be able to understand it and read it in a correct way. So the doctor completes the questionnaire, and the PDF is generated and submitted to the European Union. And then the doctor can then download the PDF. And if the doctor finds all the required information and understands, as we said earlier, understands this information in a correct medical manner, so then the solution provider validates that there is no finding and publishes what is called outcome summary report, the OSR. So the final outcome, the member state receives this validation report and the OSR and gets to the next wave, or as we said earlier, goes live. So for the international patient summary, the testing is mainly done through the participation of the organization or the system that needs to be tested for the exchange of the international patient summary, the participation of them to connectathons. These connectathons are organized either by the HL7 FIRE and or by the IAG with specialized tracks on the international patient summary. So in these tracks, in these connectathons, the participants are also given scenarios, and they need to exchange the international patient summary with other organizations and see whether the organization that receives the pairing organization that receives the patient summary is able to understand, syntactically be correct the IPS document that they receive, and then also understand the information semantically in the same way that the sender understands semantically the information. And if by the end of the connectathon there is a successful exchange of the international patient summary documents, the participants can get a certification that reports the successful exchange of international patient summary documents with other organizations or systems. So with this, the final comparison point that we made, I close this presentation. Thank you for your attention, and of course, if there is any questions, I will be happy to answer. And I would like also to remind you that we have another part of this presentation that my colleague Panayiotis Savva will present, the eHealth for You that we mentioned many times during this presentation, and how other national and international implementations exploit the patient summaries for their implementations. So thank you very much.
So firstly, I would like to introduce myself. My name is Panayiotis Savva. I am the member state co-chair of the eHealth Network Technical Interoperability Subgroup. And the job we have to do over there is about integrating and interoperating health systems within Europe. And we are also part of the University of Cyprus, as well as the National eHealth Authority of Cyprus. Now, when it comes to, of course, my colleagues, Professor Constantinos Pattichis, an esteemed, of course, researcher and professor at the university, as well as Dr. Maria Papaioannou, myself, and of course, a huge team behind us, being able to develop and deliver solutions based on interoperable standards, based on health standards. And today I will be introducing you a little bit more with regards to what is the International Patient Summary. And we will also look at how we have implemented the European Patient Summary and how that actually is delivered within the part of the IPS, in the context of the IPS. In the chat, I have provided 3 links. The first link that I have provided is documentation of one of the open source projects called HappyFire. And over here, you will be able to find the actual implementation that was implemented by the University of Cyprus, as well as Crossroad Labs, in conjunction with the Cross-STO organization responsible for the International Patient Summary. And here we have got a real implementable International Patient Summary where it's ready to use out of the box. In other words, a very little bit of configuration, and you can actually run your own IPS server running on HappyFire. The second link I've provided is the actual source code with regards to the HappyFire starter project. Following the instructions on GitHub, you will be able to start up your own HappyFire server. The last link I've provided is in context of the eHealth for You project, which was completed in actually 2024, in the middle of this year actually. And the project aimed to implement a reference implementation based on the National eHealth Law, which we'll see a little bit further in this presentation. So without further ado, I will start with the actual presentation itself. Okay, so as part of the lecture that was done on Wednesday, I believe, it's the first section was the patient summary evolution and how it evolved from EU specifications, EU guidelines, into an international specification and actually international implementation. Maria also presented the comparison between the European as well as the International Patient Summary. Today, we will go through the third part, and this is going to be one of the fun parts, I promise. It is the International Patient Summary actual implementation, where you will be able to see how it actually looks and how it works. Okay, so firstly, we will go through where I mentioned before the HappyFire IPS implementation. HappyFire is an implementation of the HL7 Fire standard, supporting various releases. Now, within HappyFire, the University of Cyprus, together with Crossroad Labs, as well as this was done in the Connectathon in Las Vegas in January of 2021. Well, we had gone ahead and we had taken and implemented the full IPS specification, and specifically it's the summary operation which is implemented and provides an IPS document, which is an JSON document providing all the details about the patient's data, at least what's specified as the summary of the patient data. The data source is actually, the data is actually stored within the HappyFire database. And from that database, you invoke the summary operation and you're able to actually view the patient summary. You can further customize the international patient summary by implementing specific interfaces. When you implement those specific interfaces and you customize the international patient summary, you can actually select your section registries and your narrative templates as well. And what does that actually mean? When Maria presented the IPS and all the different sections of the IPS, such as the alerts, the travel histories, the procedures, and all the rest of the sections, those sections are customizable within this implementation, as well as the actual narratives, and the narratives do refer to human readable text about the actual patient summary. So really, you are able to customize the way that the data is presented in a very general way when it comes to your specific implementation. Okay, so for the Happify implementation, of course, we have to have a user-friendly implementation, which does mean that the initial implementation does have the defaults already set up for you. It is flexible in the way that you're able to customize the generation of the IPS based on those section registries as well as the narratives. For the standardization, despite the customization options, the IPS maintains a standard format, ensuring the consistency and ease of interpretation across the different health systems. So keeping in mind that you are able to customize those sections, they still need to conform to the IPS implementation guide as published by HL7. And lastly, the accessibility. The integration of IPS in Happify makes this very accessible to the wider IT audience. And I hope today you will be able to see that implementation. And if you do have any questions about the implementation, I'm very happy to answer those questions as well. Okay, so the first thing that you will notice is that within the Happify IPS implementation, there is a flag that we have just simply enabled by setting the IPS enabled to true. The next thing you will see is that you are able to either implement the default generation strategy, or you're able to implement custom generation strategies, and also specifying the actual generator implementations. You will be able to find the source code over here in the GitHub repository. That's the same repository that I have posted up in the chat. All right, so within the IPS implementation, you will see that there was a customization for our specific implementation, and you can see those source code classes actually implemented over here for the eHealth for You project. Further, we go into the custom IPS generation strategy, which allows you to extend the default strategy. So you don't necessarily need to replace the full thing. You can only extend what you need. And a perfect example of this is extending and overriding the organization. So part of the IPS specification, you are able to, and you should be able to specify which is the organization that is generating that specific IPS document. And this over here is an exact example of an implementation where we have now set the organization to the University of Cyprus, and we have put the address of the university that is actually generating this project, this IPS document. Okay, looking further, you're able to extend the implementation, which means that you do not override it, you do not replace it, you simply extend that specific implementation. And that implementation, you're able to specify your own custom generators for those sections as well as the narratives. Okay, so again, looking at the extension of each and every specific section, again, outlining that you're able to fully customize those sections. Over here, you can see that we've added the section for allergy intolerance, the medication summary, and the problem list within this specific example. And finally, just to make sure that the credits are given towards the people that have developed this implementation. So the development of the IPS module is in Happy Fire, and it's a result of the collaborative efforts by Rio Benin of Crossroad Labs, myself, Panayiotis, as well as one of my colleagues, Constantinos S of the University of Cyprus. However, this also does include all of the rest of the colleagues that do work with us. And a big thank you, of course, to Maria and to Professor Pattichis for making these implementations possible and offering it to the wider world out there that can make use of this today. Okay, so let's talk about the reference implementation. So firstly, the eHealth for You project was a research initiative. And it was a pioneering project for Cyprus, which was the first implementation and the only implementation to date that we know of that implements a reference of the National eHealth Law 59 of 2019. And that law specifies how the data is supposed, what sort of data is supposed to be retrieved, and also specifies rules around the data, such as consent management. And of course, this is the implementation of the National EHR Data Bank. So for the core objective is to enhance the citizen-centered healthcare by ensuring that the system is intuitive and accessible to all stakeholders. It's there to enforce the standards of confidentiality as well as safeguard the patient's information. One of the most important things that I could say here is that when speaking about patient or citizen-centered healthcare, it is important that the patient is able to access their data. And in fact, the IPS standards and the standards implemented around the sharing of the IPS allows for this to happen. There is a HL7 profile called the IPA, the International Patient Access, and there's also technologies which is the Smart Health Links, which also allows the sharing of the International Patient Summary. And we will actually see the implementation of the latter a little bit later today. Okay, so some of the features of the eHealth record that you will be seeing today. So I promise I will be showing you some nice screens a little bit after this, which you will be able to actually see how we have achieved these features. So we do have robust security measures to protect against sensitive health data. And one of the core things within the system is interoperability, which means that systems are able to speak to each other in a standardized way and in a way that is testable, in a way that is communicatable as well. Now, when looking at the citizen-centric approach, it's about empowering the citizens with ownership of their own electronic health record data. It's important, at least within the European context, to promote transparency as well as trust when it comes to health data. And ensuring the EHR system aligns with the patient's needs and privacy concerns as well. So you will also be seeing an elaborate implementation on consent management, where a patient is able to give access to a healthcare provider via the eHealth for You system. With regards to the national scope, a collaborative effort in line with the Cyprus National eHealth Law was to establish a unified electronic health record repository. So here we have tried to follow a central repository. We are a very small island of around about a million or just shy over 1 million people. And it's engaging a broad spectrum of healthcare sectors, including private companies, policymakers, as well as the public sector. The strategic outcomes was to establish the single eHealth records data bank. So you will see this SEHRB, and that was to centralize this data. A step towards the national integrated healthcare ecosystem, facilitating research, policymaking, and service delivery as well. Okay, so when looking specifically around the system requirements, the first and utmost was about the legislation in order to have an implementable reference implementation based on the eHealth law. The data privacy and security, again, is a major pillar. The system requirements, what data is actually required to be stored and how that data is stored. And then lastly, interoperability, and of course, this is not the least. It is extremely important that the data is transferable, the data is processable by others as well. So with the system requirements and looking at the international patient summary, it does concern primary data. And primary data does refer to the data captured by the healthcare professionals in order for treatment of certain ailments or of the patients. And this, of course, does include many different, it does include many different, specialities, including cardiology, endocrinology, gynecology, surgery, etc. Okay, so when looking at the system requirements, we have broken down the components into 3 main subcategories, which reflects how the healthcare providers use the information in the routine workflows. Aided by the medical team, these are the medical history. And of course, these are the medical records, the clinical examination, as well as the laboratories. Within the slide, you will see an example of how the patient's EHR is structured in the eHealth record. More specifically, the analysis of the medical record into a set of subcategories is presented. Each subcategory includes the data that describes different dimension of the citizen health status. The other 2 EHR components are also analyzed into different subcategories following the same structure. So you can see, as an example, the alerts. And within the alerts, we have got the types, the adverse event type, the agent, the reaction severity, and the date. All these sections that we can see over here is made up of the international patient summary. And there is also an extra section, which is the travel history, which also makes it into the European patient summary. Okay, so throughout our interaction with the medical experts, we have defined the structure of the EHR. However, we also had other sets of requirements to consider, and that was the ability of our system to communicate health data with other eHealth systems, not only in Cyprus, but abroad as well, to increase the chances that a citizen in Cyprus that has the eHealth for You EHR can receive quality healthcare in any country. So the first thing that we did was to address the requirements set by the European cross-border healthcare services, and more specifically, the European patient summary as defined by the eHealth network guidelines, including specific data sets and terminology. Then we took a step further and decided to design our system in a way that allows the exchange of the international patient summary. And so we also address the requirements as included in the ISO 27269 that Maria did mention on Wednesday. During this process, we saw that the International Patient Summary uses the eHealth Network guidelines as the source, but it's technology agnostic and more flexible in terms of terminology. So I think Maria presented that as well, where the International Patient Summary is very flexible when it comes to the terminologies, whereas the European Patient Summary was in fact very strict. The CEN adopted the ISO 27769 standard as a European standard, rather than the original EN 17269, which the standards in Europe will now refer to as the EN ISO 27269 of 2002. Okay, so this document defines the core data set for a patient summary document that supports continuity of care for a person and for the coordination of their healthcare. It is specifically aimed at supporting the use case scenario for unplanned cross-border care and is intended to be an international patient summary. Whilst the data set is minimal and non-exhaustive, it provides a robust, well-defined core set of data items. The tight focus on the use case also enables the IPS to be used in planned care. This means that both unplanned and planned care can be supported by the data set within the local and the national context, thereby increasing its utility and its value. It uses the European guidelines from the eHealth network as the initial source for the patient summary requirements. Then it takes into consideration other international patient summary projects to provide an interoperable dataset specification that has global application as well as global impact. This document provides an abstract definition of the patient summary from well-derived models available and implementable as well. Due to its nature, readers should be aware that the compliance with this document does not imply automatic technical interoperability. This result enabled by this document can be reached with a conformity to the standards indicated in the associated technical specifications and implementation guides. This document does not cover workflow processes of the data entry, data collection, data summarization, subsequent data presentation, simulation, or aggregation. Furthermore, this does not cover the Summarization Act itself, the intelligent competencies that result in the data summarization workflows as well. It's not an implementation guide that is concerned with various technical layers beneath the application layer. Okay. Eventually, eHealth for You can exchange patient summaries with any system of any country that either implements the EU patient summary or the international patient summary, using the data set from the international patient summary and the terminology of the European patient summary. Okay, and here are the categories that we have seen before, including the allergies and intolerances, the history of the problems, the medication summary, the immunizations, the history of the procedures, the medical devices, the results, the history of the pregnancy, the social history, as well as vital signs. It's important to note that these are not limited towards these specific categories. These are expandable, and the International Patient Summary does allow for custom sections as well. Okay, and over here we can see how these are now categorized further. And an example of the immunization, this is the value set taken from the EHDSI, taken from the master value catalog of the eHealth, of the EHDSI. Therefore, the eHealth for You is an IPS as well as an EU patient summary conformant, while we are targeting being aligned with the two requirements of the other interoperability initiatives, which included the projects of eHealth as well as the international patient access. Okay. All the information included in the EHR system will be exchanged between the healthcare systems nationally and at a worldwide level, on a global level. An interoperability framework specifies the tools to achieve that. All right. So following the European Commission recommendation of 2019, the recommendation was number 243, the HL7 Fast Health Interoperable Resource Standard was thoroughly studied, evaluated, and was selected to be the main interoperability vehicle of the eHealth for You project. Another provision of the eHealth for You interoperability framework is to capture the citizens' health data in a structured form to facilitate its integration with various third-party systems in the national eHealth ecosystem. To this direction, the terminologies such as SNOMED CT, ICD-10, ICD-11, LOINC have been used to describe the FHIR profiles. Within the chat, I had posted the last link, which does include that profiling work that was carried out. And it would be great if you did actually go ahead and review those profiles as well. And then finally, the eHealth for You project is designed to address the requirements deploying the eHealth services across all European countries as directed by the eHealth Digital Service Infrastructure Initiative, as well as the European Directive of 2011, and that was Directive 24 on the patient rights on cross-border care. In this regard, a mapping between the eHealth for You EHR fields and the master value catalog is done and is included in the FHIR terminology services. Okay, and then just as a summary of this, and that's the overview, that we do follow the legislation in the national eHealth law as well as the GDPR. For the data and privacy, we have, of course, auditing, authentication, authorization, as well as consent. With regards to the system requirements needed to consider the HR components, the healthcare, as well as the administrative parts of the system, and the all-important interoperability, implementing the HL7 FHIR standard and using the master value catalog from the European EHDSI in order to achieve interoperability from a European level as well as an international level. Right, so up to this point, I would like to ask, is there any questions with regards to the implementation or the specifications around the international patient summary? If not, I would go ahead and I would present the actual demonstration of the software. All right. Okay, so let's look at the eHealth for You system. So this is a login screen, of course, with a username and password. This could be integrated using any authentication mechanism. So the first screen that you see over here in front of you is the practitioner's home screen. So this is the healthcare provider's home screen. And over here, you can see where he's got the ability to search for a specific document, a person by name, surname, date of birth. And by clicking search, he's able to list the patients that he has consent to view these patient data. And over here, you can see that there's partial consent as well as full consent supported. So once you click on a patient, it opens up the patient view. And the first thing that comes to the screen is the alerts section. The alert section includes the allergies, the major medical problems, the procedures, the drug use, tobacco use, as well as some other sections, such as any devices that have been implanted, etc. And I think you can see medical devices, drug use, tobacco, procedure, and major medical problems. Now, here you can see the navigation where you've got the alerts, and now you can start navigating to the different sections of the actual EHR system. When clicking on the profile, so you click on the little eye here, you can see the personal information of the actual patient, as well as the demographics, emergency contracts, as well as the practitioner. When clicking on the medical history, we can see the different sections, and this is a navigation section of the EHR system. And of course, all the data that you do see here encapsulates the international patient summary fields and any fields that were deemed required when undergoing analysis of the medical data required by the practitioners in Cyprus. Okay, so over here you can see the social history, alcohol consumption, tobacco, drug use, sleep habits, exercise, the immunizations, the plan of care. It further goes down to the epidemiological history, the medical personal history, problems and procedures as well. And over here we can see the medication summary, you can see the onset dates, the active ingredients, whether it was given or not, the route of administration, the product names, the strength. It's important to note that all the data that you do see coming up on the screen over here is actually fetched from the Happify implementation, and also that the values that can be presented here are that of the terminology server implementing those EHDSI profiles that we had spoken about before. Okay, moving forward to the clinical examination. Here we can see the initial evaluation, we can see the vital signs, and of course there is the option to chart those vital signs as well by clicking the chart views. And the symptometrics as well is captured. Within the laboratory, you can see over here where you're able to see specific laboratories, and you're able to expand these as well. You can download the PDF documents as well. And the same goes for the imaging, where all the observations are captured, as well as the PDFs, which may contain those images as well. So currently there is no live viewers such as a DICOM viewer integrated, but that is future work to be done. And lastly, the episode of cares, again, having the potential diagnosis for each and every episode that was recorded, and the history of those episodes and the visits of each of those. So here you can see where the visits have been recorded for that specific patient. Okay, so typically when a patient goes and first sees a doctor, the patient, the doctor needs to be able to record that there is a new episode of care that has occurred. He's either got the option to select an existing episode of care, or he's got the option to create a new episode of care. Once the episode of care has been created, the doctor is able to then start adding. Firstly, he will see the alerts of the patients, and then he's able to start adding specifics around that episode of care and that specific visit. Over here is an example where the doctor is searching for a medical product, either identifiable by the active ingredient or the advertising name of the product as well. And of course, we do have the ability to add now the posology. And of course, it goes without mentioning, all of the data that you do see here is fully compliant with the international patient summary. Over here, we can see a screen where we are able to add the vital signs, including the blood pressure, the heart rate, the temperature, and the respiratory rate. Similarly, we are able to add the, we're able to view the visit summary. So any data that the practitioner, the doctor, has added to the patient record is shown as a summary, and as you can see over here. So what was done, travel history was added, the medication was added, as well as alcohol consumption was added to this patient. And then finally, you're able to add the potential diagnosis. And once you save this, you can see the before and the after, where the patient now has got the new records added based on that episode of care. Okay, so that summarizes the actual medical section of the International Patient Summary. The next slides will demonstrate the management of medical teams, and also shows how to add the consent from the patient to the practitioner. So over here we can see that a medical doctor is able to create a medical team. He's able to add locations. He's able to edit locations, manage the team members, and he's also able to inactivate teams here as well. We do have the medical teams currently defined over here. So, of course, this is all testing data. And over here we can see that we can now see the patient's home screen, and where the patient is able to provide access to a doctor. In other words, give him a consent for that doctor to see his record, or he's able to revoke a consent from his record. And we also do have the history of the consent. So in this screen, you can see the consent history, which of the practitioners had access to this medical data, what was the specialities, for which team, which organization, and as well as the consent. I think it's important to state here what the partial and what the full access is. When looking at providing access to medical data, sometimes patients may want to restrict the medical practitioner from seeing some specific data. And the reason for doing so may be that data is sensitive and irrelevant for the reason for visiting the doctor, or it may be that perhaps they are looking for a second opinion and they do not want to introduce any biases within that doctor reviewing the condition, and thus may block such data from the doctor being viewed. It's also important to note that within the eHealth law of Cyprus, a doctor may choose not to see a patient if they have locked data. So it's up to them as well to be able to say yes or no, I will see this patient or not. Okay, over here we can see the screen where a patient is able to provide the consent for a specific doctor. And over here we can see that they can choose which is the doctor. They can search for the doctor to say which district, which town, which village that doctor is from, and then later we can actually select and see from which medical team and which organization they are from. And of course, once they have selected the doctor, they are able to give this full consent or the partial locking of data. And here's where I said previously, the doctor may choose not to treat you if you do lock data, and it is a disclaimer given to the patient at this point. Finally, once the patient has selected the doctor and able to give him access, he's able to see the summary of all of the data that the doctor can actually see. This is restrictable up to the observation level, so it's on a specific fire resource level. Okay, and what we see here now is the patient's view of the electronic health record. So when a patient logs into the eHealth for You system, that patient is able to see his own medical data. You will notice that this screen lacks the ability to edit data. It is there for his viewing. It's the same layout and the same concept when it comes to the data. However, there is a restriction where he's not able to add new visits, and also he sees the data without any restrictions, since this is his own data. His or hers data, should I say. And then lastly, when it comes to the international patient summary, the wonderful thing about the IPS is that you may receive an IPS document from another country, from another organization, whether it's a national system, an international system, or in fact, it could even be within the same organization. Once you receive that data, it is very standardized in the way that it is processed. And as such, we can, within the eHealth for You system, specifically look at a specific international patient summary record. So over here, you can see that we have the international patient summary document preview, where we've got the patient, the document composition, and then starts with the actual sections of the international patient summary. And of course, all the data is represented for that specific international patient summary record within all the sections as well. And lastly, but not least, under the eHealth for You program and under the European authored project, we have also implemented the mobile application, which allows the patient to view his data on the go. And not only that, it allows for patient-mediated access to the data, to the health data. And this does utilize the technology called Smart Health Links, as well as the International Patient Summary. Over here, we can see where a patient is able to create a new Smart Health link, which means that he will now share his medical data. He's able to select which specific resources, which observations he will actually share. So here we can see resource selections, and then lastly, he's able to provide a passcode, a label so that he can easily identify why he generated this, and then an expiration of this link. So once he generates this link, you are given, over here you can see the Smart Health link that is generated, and an access code is given. Upon generating this code, we're able to share it, copy it, or actually open it up and see it. Now, when opening up a Smart Health link, any doctor opening up a Smart Health link will be directed to this page where he or she is able to see the patient summary in full. Is able to collapse, is able to print that patient summary as well, allowing for ease of access to this medical data. And of course, over here, you can see that in this case, there is an allergy substance given. And of course, this is under the major medical, under the allergies and alerts, which is quite important data. And you can see that the criticality is highlighted here as high critical as well. Okay, and in conclusion, the successful integration of the eHealth for You project demonstrated a seamless integration of the HappyFire IPS implementation, and of course paving the way for enhanced interoperability and data exchange across the health systems. And looking at the user design, the initiative emphasizes a user-centric approach, showcasing a tailored UI that simplifies interaction for the healthcare providers and the patients, and it's aligning with the primary goal of the accessible and efficient healthcare delivery. And then lastly, the blueprint for future expansion. This reference implementation serves as a scalable blueprint for future national and international EHR systems, setting a precedent for adopting standardized health records in improving patient care and health outcomes as well. So given that, I would like to, of course, mention the partners that were part of the eHealth4U consortium. And of course, the project coordinator, Professor Constantinos Pattichis, and of course, also funded under the European Regional Development Fund of Cyprus. And the members that have contributed to the delivery and the deployment of the eHealth4U system. Of course, a big thank you to those members as well. And lastly, here is a link of all of the resources that I have presented here today, including the HappyFire server, the JPA starter, the eHealth4U backend, the website, the mobile application, the European Patient Summary Guidelines from the eHealth Network, the International Patient Summary ISO standard as well as the EHDSI value sets, an example of that at least. So with that, I would like to thank you for that opportunity to present this to you today.